Well, I think there's a lot happening in the marketplace today, and the two big drivers are the adoption of electronic health records, and the second is the transition toward a value-based purchasing system. And so the two go together. In fact, the EHR adoption story goes back a number of years now. Even 10 years ago, we actually had reasonably mature electronic health record companies and software available, but there was very little uptake. There was maybe only 5 to 10% market penetration as far as the number of physicians using EHRs. But it was only in 2011 when the Meaningful Use Electronic Health Record Incentive Program from CMS began paying incentives to physicians and hospitals that we started to see a real uptake in EHR adoption. So that program led to some standards and some reasonable expectations called meaningful use, and now we're over 50% in just a few years, and I anticipate we'll be moving well over 90% in just the next few years. So that's very exciting. That allows physicians to exchange information between other physicians, between hospitals, and to use data in a way that we can more precisely assist patients, predict potentially where illness will occur, and provide safer and more effective care. The second big piece is the financing, and this is the movement toward value-based care. This really is most notably spearheaded by the ACO movement. So the CMS, the Center for Medicare and Medicaid, is now incentivizing physicians and hospitals to work together with capitated payments to deliver care for a defined population. So in the past, physicians would typically see one patient at a time and get paid for those office-based visits or those hospital-based services. Now, with the Accountable Care Organization, physicians and hospitals are responsible for a whole population of Medicare patients. That means the incentive now is to keep patients healthy, prevent them from going to the hospital where typically a lot of resources are expended, and to optimize the care and essentially create good value so that the resources that are spent are providing the best health status for our patients. So these two together are really a synergy that will lead to substantial change. It's already leading to changes in roles, changes in relationships. We see health systems getting even larger than they've been before, and the reason for this is that technology is needed, and diversity of specialties is needed, and more collaboration between hospitals, doctors, and other hospitals, physicians, and other players like home care companies, hospice, for example, ambulatory surgery, and all those other participants that help deliver care to patients. Well, I think there are a number of things we need. Most importantly, though, we need better tools for population health and for patient engagement. And so, from a physician perspective, we need information tools that merge information from not only my medical practice and my electronic health record, but from the hospital, if a patient's been hospitalized, from home care, from, for example, their insurance company and their pharmacy benefit management company. So once that information can be brought together and put in a view that I, as a clinician, can help to be the quarterback for my patient, advocate for them, we'll be in a better position. Traditionally, I've had access to data one patient at a time, but not had the ability to look at data, say, across my whole population of diabetic patients, or my whole population of migraine headache patients, or pregnant patients, or whatever the interest group I need. The second set of tools are ones that patients are going to use themselves. So this ranges from their handheld device, their smartphone, to their laptop, and the ability to engage patients with information that's relevant for them, in particular information that coaches them and brings them through self-care and prevention, and helps them to, say, compare themselves to their peer group so they can really understand what's possible for their health, for their asthma control, for their diabetes control. And so I see a lot of innovation in this space, and it's a great time to be in healthcare and health informatics, so we can expand the reach and help patients.